In March last year, when I announced our alert level system, I said that the world had changed, and quickly. But we carved our own path then, and now we can do that again. Our focus on elimination kept us free from COVID for much of the past 18 months, at a time when our population was vulnerable to this virus. It kept our case numbers low and our hospitals from being swamped. Our economy held up well and unemployment stayed low. We can rightfully be proud of what our world-leading response has achieved. But two things have changed since then. The first is that Delta has made it very hard to maintain our elimination strategy. Its tentacles have reached into our communities and made it hard to shake, even using the best public health measures and the toughest restrictions we had available to us. But right as our long-standing strategy was challenged, we also had a new tool, one that means as COVID has changed, we could change too. And rather than being locked down, we could move forward safely and with confidence. That tool is the vaccine. The vaccine we are using in New Zealand is safe and effective. If you are vaccinated, it means that you are less likely to catch the virus and much less likely to end up in hospital if you do. It also helps protect everyone. The more people who are vaccinated, the harder it is for COVID to spread through communities quickly and find our most vulnerable. That means while we used to say that we needed to stay home to save lives, we now need to be vaccinated to save lives. And this is where New Zealand has the chance to continue to carve our own path. Very few countries have had the opportunity to vaccinate people before COVID was in every corner of their communities. We can. Once we have done that, we then need to make sure we keep using that tool to protect ourselves as we gradually and carefully open up. Not all countries have had that chance, and some have opened up with vaccines very quickly or without any other public health measures in place. Our plan will do things differently. That's because our goal, based on the advice of Professor David Skegg and the Public Health Advisory Group, is to minimise and protect. Minimisation means that we are aiming to keep the spread of COVID-19 as low as possible, that while there will be some level of cases in the community on an ongoing basis, we will work to contain and control any outbreaks, and if practical to do so, stamp them out. Protection means that we won't just treat COVID like a seasonal illness. We will protect people from it with vaccination, management, and a response that focuses on minimising the significant health impacts we know it can have. But how will we make our strategy to minimise COVID and protect people work, whilst also making sure that we keep moving forward? The first step is with high vaccination rates. You'll know that we are being resistant to setting a target. We didn't want to leave anyone behind, and we still don't. But we need to give everyone, and especially Aucklanders, certainty over when it will be safe enough to transition to a new system, one where we can give more freedoms to those who are vaccinated. We've looked at all of the evidence, talked to experts, looked at modelling for our situation, and set a target of 90% fully vaccinated for each DHB in New Zealand. The reason we're focused on each DHB is because we need every region to be highly vaccinated. And by focusing on DHBs, we also make sure we get more equitable outcomes. And when every DHB reaches this target, that is when we'll move into a new framework called the COVID-19 Protection Framework. Let me tell you how this new system will work. Similar to our current alert level system, there'll be 3 settings: green, orange, and red. They're designed to help us manage outbreaks and cases. While you could have cases in the community at any of the different settings, we can use them to try and get numbers down if they're affecting people's safety and our health system. There are 3 big differences between this new system and our current one. The first is that it uses vaccine certificates. Basically, if you want to be guaranteed that no matter the setting that we are in, that you can go to bars, restaurants, and close proximity businesses like a hairdresser, you will need to be vaccinated. The second difference is that with vaccine certificates, at red, orange and green, businesses will be able to continue to open and operate. This, I know, is the certainty that many have been looking for. And the third major difference is that rather than use general nationwide lockdowns, if we have cases that start to climb and in areas where we have lower vaccination rates and vulnerable communities, we can use more highly targeted and very localised lockdowns if we need to. Let me give you then a very quick run-through of each of the settings. The red setting is what we'll use when the virus is spreading in a way that means we need to take action to protect our most vulnerable and prevent too much pressure on our health system. So here, while hospitality is open with vaccine certificates and retail is also open with the usual public health measures, gathering limits and physical distancing will also be required. Education will be open, but with public health measures in place. Working from home is encouraged. Masks will also be required in the same way we use them now. This will still feel like a huge amount of freedom relative to what Auckland has now. And because they have done so much work to lift their vaccination rates, and because of the border around the city, rather than wait for the rest of New Zealand, Auckland will move into red as soon as all 3 of the Auckland DHBs hit the 90% double vaccination target. To everyone in Auckland, our businesses, people on their own, families with young children, everyone, I know this period has been so hard, but you are so close. Right now, you're just 16,000 vaccines away from every DHB hitting the 90% target for first doses. When that turns into double doses, that's when this new framework kicks in for you. And I know that vaccination certificates will help us get those numbers up. For the rest of the country, once every DHB hits 90% double vaccinated, we anticipated we will move collectively together to orange. At orange, everyone remains open, but because of vaccine certificates, all of the gathering limits currently in place for events, gatherings or hospitality, they can lift. Places that choose not to use vaccination certificates will either be closed or will have public health measures in place. Green is when there is some COVID in the community, but at low levels. Fully vaccinated people can enjoy all events and hospitality and gatherings by showing a vaccine certificate. Where premises choose not to use vaccine certificates, they will face restrictions on numbers and spacing similar to the current alert level framework. Face masks will only be mandatory on flights, but will be encouraged in indoor settings. There is quite a bit more detail for each of these settings, but they will feel familiar. We've based them on what we have learned from using our old alert levels. But the reason we have changed from this system is because we needed one that could make use of the new tool of vaccines and vaccine certificates, a way that we could keep vaccinated people safe from those who have not been. And thinking about these settings and when the country moves into them, we did specifically think about the South Island. We also thought about scenarios where we are close to the targets for each DHB, but possibly stuck a small way shy of where we want to be to transition. That's why on the 29th of November, Cabinet will review the progress that Auckland has made and the rest of the country to see if anything needs to change. We are open to moving the South Island before the rest of the country if all the DHBs in the South hit their targets before others. And for Auckland, who have done all of the heavy lifting in this outbreak, we have a collective goal now. But in the meantime, we will still keep assessing the settings we have. And if it's safe to do so, use the step downs that we have already talked about. But rather than having to wait week to week, I hope the announcements today give you a better sense of the destination. So you can see here that our plan gets us moving forward, but in a safe way. And we are better placed than so many others have been to do that. But we will have COVID cases in the community, and more than we have experienced before. But because we won't take this step until we are at 90% vaccination, we will also have high levels of protection that limit COVID's impact. In fact, we'll be one of the few countries that will have such high levels of vaccination while still using public health measures to keep everyone as safe as we can and enjoying the things that so many have missed and loved. And it's all because of vaccines. Vaccinations are our armour. They help keep us safe. So my message to New Zealanders who have not yet had their first dose: if you want summer, if you want to go to bars and restaurants, get vaccinated. If you want to get a haircut, get vaccinated. If you want to go to a concert or a festival, get vaccinated. If you want to go to a gym or a sports event, get vaccinated. If you are not vaccinated, there will be everyday things you will miss out on. And if you are vaccinated, you can be assured that in the new framework, you'll get to enjoy the things you love, secure in the knowledge that the people around you and the environment you are in is as safe as possible in a COVID world. If you've done the right thing to keep yourself and others safe, to look after one another, you should feel safe. You should be protected from those who haven't made that choice. That's what the protection framework seeks to offer vaccinated New Zealanders. To sum up, our strategy moving forward is to minimise and protect. Our alert level system has charted us through a global pandemic in a way that kept us relatively free from the virus, and we now have our playbook written if we ever needed it again. But now we have vaccines. We cannot ask vaccinated people to stay home forever. So now we need a new playbook to reflect a population protected from COVID, and that's what this is. I know you'll want as much information as possible at a time like this, and so, as always, more detailed guidance on the announcement can be found at covid19.govt.nz, including the details of the system I've just outlined. But just as we did for the alert level framework, we will continue to work through detailed plans for each sector, and this detail will be progressively added. Till then, to the team of 5 million, thank you again for doing your bit in our distinctive and world-leading fight against COVID-19. I have no doubt that we'll do what it takes once again and move forward safely together.
Kia ora, ngā mihi nui ki koutou katoa. Thank you, Prime Minister. We know that over the last 20 months, the approach New Zealand has taken to COVID and Delta has saved lives and livelihoods. Along with one of the lowest mortality rates in the world, we have also had strong economic growth, low unemployment, and one of the lower levels of government debt in the world. New Zealand's early success in dealing with COVID has given us options to deal with the Delta outbreak from both a health and an economic point of view. But for people in Auckland right now, I know that this is tough. Over the past couple of months, I've been asked several times whether I'm aware of the impact that restrictions are having on businesses and workers around the country, particularly in Auckland and the Waikato. And I can tell you without a doubt that I am acutely aware of that impact. I regularly speak with businesses, workers and their representatives from around the country, and I have heard their concerns. We have responded with significant support and with changes and additions to that support over the last 2 months. To date, we have paid out about $4.8 billion in support since the Delta outbreak began in August. That amount exceeds the new operating spending we would have for a whole year for the whole country in most budgets. But we are not through this outbreak yet. And as we have done consistently over the past 20 months, we are adjusting in response to the circumstances. I know this outbreak has been particularly hard on Auckland, and the coming weeks will continue to be tough as we lift vaccination rates so that we can move to the new COVID protection framework. To support businesses through this transition, today we are announcing an enhanced business support package. Firstly, we are significantly boosting the resurgence support payment. After the next scheduled payment on the 29th of October, we will move to fortnightly payments at double the current rate. The first of these will open on the 12th of November. Currently, the resurgence support payment is a 3-weekly payment of $1,500 per eligible business and $400 for each full-time employee, up to a total of 50 full-time employees, or a total of $21,500. For the payments starting on the 12th of November, this will be $3,000 per eligible business and $800 per FTE up to 50 FTEs, making for a maximum fortnightly payment of $43,000. In effect, this means the resurgence support payment will be a weekly rather than 3 weekly payment, as it is now. But for ease of application and administration, it will be available in fortnightly instalments. We're not going to change any other settings at this time in order to ensure that the payments can be made without disruption. We made the decision to use the resurgent support payment because it means the support can be provided quickly using an existing mechanism, and because the resurgent support payment provides businesses with the maximum flexibility as to what they use the money for. The resurgent support payment is now targeting Auckland businesses, with 70% of payments going to Auckland having grown from 40% at the first payment, and the next highest area is the Waikato, with close to 10% of the claims. This enhanced resurgent support will be paid fortnightly until Auckland has been able to move into the COVID-19 protection framework. As a reminder, the wage subsidy will continue to be available on the current criteria while areas of the country are still in Alert Level 3. The cost of providing both the weekly resurgent support payment and the wage subsidy is estimated to be up to $940 million per fortnight through this transitional period. The second element of the business boost we're announcing today is a $60 million fund for business advice and mental health support in Auckland. This will be delivered through the established Regional Business Partner Network, with grants for advice now not requiring a matching contribution from the business. Businesses will be able to apply for up to $3,000 worth of advice for planning support and then receive up to $4,000 to implement that advice. This fund has been requested by businesses. It worked well in the first phase of COVID to support businesses to realign themselves with a changed and challenging business landscape. Some businesses used it to develop a new online presence, others to change the focus of their production or to target a different market. As part of the package, $10 million has been provided for mental health and well-being support to small businesses. This will be delivered through a program that is to be designed in conjunction with the EMA and the Auckland Business Chamber of Commerce. A couple of other announcements to mention today. We know that COVID-19 restrictions are having an impact on low-income households, so we are making it easier for people to get assistance. Currently, a single person working 30 hours per week on the minimum wage is not eligible for hardship assistance from Work and Income. Minister Sepuloni is announcing today that from the 1st of November, we're lifting the income limits for assistance to 40 hours at the minimum wage, or $800 per week, and $1,600 per week for a couple with or without children. This is estimated to mean that 25,000 more grants will be made to low-income workers over the next 4 months. Cabinet has committed to reviewing the use of this assistance, and we may extend it as is needed. We are also developing further support for individuals and families experiencing hardship as a result of the Delta outbreak, which I will be discussing with Cabinet in the next few weeks. Cabinet has also approved a significant package to help lift Maori vaccination and support Maori community response to Delta, which Minister Henare will outline shortly. Just before I finish, I'll turn to the assistance that will be provided under the new framework. Cabinet has made in-principle decisions on financial support which will become available when the new framework takes effect. I'll be taking a paper to Cabinet in November confirming the details of that support and any other outstanding decisions relating to the transition, but I will provide an overview of how we will do that now. Firstly, a transition grant will be made available to support particularly Auckland businesses when they move into the new framework. This grant will be based on similar criteria to the resurgent support payment. Once the framework is fully operational across New Zealand, this will be the time to replace the current support schemes with something that will better reflect the new framework. I will be proposing to ministers financial support that targets the most affected businesses for when areas of the country are in red. One of the issues that we are working through is what to do in terms of businesses who decide not to be part of the vaccine certificate regime. If we use the current settings based on revenue drops, we may well end up supporting them, but not those who are using certificates. It is my personal preference that any payment will not be made available to those businesses that should be operating using a vaccine certificate regime, but choose not to. However, this requires further work to be operational. Across-the-board support will not be provided for areas designated as orange or green, because at these levels, businesses will be able to operate as normal, with some requiring vaccine certificates to do so. We are also seeking further advice on what support could be made in the event of local lockdowns. Throughout all of this period, there will also continue to be ongoing support for people to isolate as a result of being exposed to COVID or being tested, regardless of where the people affected are based. As we've done consistently over the last 20 months, we will listen carefully to business and the wider community about the impact of Delta, and we will evolve and change our responses as required. Delta has tested us all, and I know that we have asked a lot of people as we have fought this outbreak. I thank you for all the sacrifices you have made while we get people vaccinated. We are almost there. And to reiterate the words of the Prime Minister, please get vaccinated. And if you are vaccinated, please talk to anyone you know who is not and explain them that we all need to step up together.
As you have heard from the Prime Minister, the new protection framework will support us to keep people safe, especially our vulnerable communities, and minimise the impact COVID-19 has on business and our day-to-day lives. If you want to protect yourself, your whānau and your community from this deadly virus, high vaccination rates is the only way you can do this in order to protect our whānau. So far, over $250 million has been allocated to support Maori since the start of the pandemic. That's why today I'm pleased to announce alongside my colleagues a further $120 million fund to support Maori communities to fast-track vaccination efforts and prepare for the new COVID-19 protection framework. $60 million will go towards further supporting our Maori vaccination rates, and a further $60 million will support Maori and iwi-led initiatives to protect our communities against COVID-19. Our kuia kaumātua are leading the way, and now we need the rest of the whānau to do the same. Currently, 67% of the eligible Maori population have had at least one dose. Of those, 46% are now fully vaccinated. This describes the challenge in front of us, and in conclusion, I say to my whānau and to our people, koe nei te wā, the time is now.